Welcome again to Nurse Wise channel. And today we're going to tackle about the significance of correct and easy way on IV and drug calculations. The drug calculations are an essential skills for nurses. Nurses need to be able to perform them correctly to calculate correct dosage of drugs to administer to patients. As we all know, for patient safety, accurate drug calculations are essential to prevent medication errors, which can lead to adverse reactions, harms, or even death in patients. And achieving competence in drugs and IB calculations can help prevent patient harm. So, join me on how to do IV and drug calculations for adults and pediatrics. If you are new to my channels, please like, share, and subscribe to get updated to NurseWise nursing related vlogs. Let's go! So, let us first discuss the formula of IB flow rates and how to get milliliters per hour, drops per minute, infusion time. The next is calculating IV drop factors, micro drops, macro drops. Then lastly, adult and pediatric drug calculations. For intravenous calculations, it is important that calculation of the IV rate administration is accurate. However, it is useful to be able to perform this calculation from first principles and to do them step by step. To calculate IV flow rates, the nurse must know the total volume of fluid to be infused and the specific time for the infusion. First, calculating the ml per hour. The total infusion of volume per ml is divided by the total infusion time per hour. Second, calculating drops per minute. The total infusion in volume per ml divided by total time of infusion in minutes and multiplied to the given drop factor. Third, calculating the infusion time, the total volume to infuse in ml divided to the milliliters per hours. First, to get the milliliter per hour, total infusion volume in ml is divided to total infusion time in hour. For example, your patient needs 1000 ml of saline IV over 4 hours for a patient with deficient fluid volume. How many milliliters per hour? So, the given total infusion volume ml is 1000 ml. The total infusion time is 4 hours. The computation is 1000 ml is divided to 4 hours, so the answer is 250 ml per hour. Second example, the doctor order says 300 ml of normal saline to infuse over 6 hours. What is the hourly rate? A. 90 ml per hour. B. 50 ml per hour. C. 1800 ml per hour. D. 100 ml per hour. The computation, guys, is very easy. 300 ml divided to 6 hours equals 50 ml per hour. Second is calculating the drops per minute. Total infusion volume divided to total time of infusion in minutes and multiplied to given drop factor. Example, a patient is receiving a 250 ml normal saline IV over 4 hours using tubing with a drip factor of 10 drops per ml. How many drops per minute should be delivered? Where the total infusion volume is 250 ml and the drop factor is 10 drops per ml and the total infusion time is 4 hours or 240 minutes. So the computation is 250 ml divided to 240 minutes and multiplied to 10 drops per ml. So the answer is 10.42 drops per minute or 10 drops per minute round off. Another example is to get drops per minute. The doctor's order says infuse 1500 ml of lactated ringer over 12 hours. The drip factor is 15 drops per ml. What is the answer? A. 31 drops per minute. B. 32 drops per minute. C. 95 drops per minute. D. 15 drops per minute. The answer is A. 31 drops per minute. And where did I got my 720 minutes? I multiplied the 12 hours infusion time to 60 minutes because in 1 hour there are 60 minutes. The computation is 1,500 ml divided to 720 minutes and multiplied to the given drop factor 15 drops per ml. So the answer is 31.25 drops per minute or round off of 31 drops per minute. Third is calculating the infusion time. The formula is total volume to infuse in ml and divided to milliliters per hour being infused, ml per hour. Example, a patient is ordered to receive 1000 ml of normal saline solution to be administered at 125 ml per hour. So how many hours will pass before you change the IV bag? So the total volume to be infused is 1000 ml and divided to 125 ml per hour. So the answer is 8 hours. So the IV of 1000 ml will be infused for 8 hours. Another example, the doctor orders 1000 ml bag of IV normal saline to be infused at a rate of 50 ml per hour. How long will it take for the IV bag to completely infused? A. 10 hours. B. 2 hours and 10 minutes. C. 20 hours. D. 36 hours. The answer is 20 hours. The computation is 1000 ml of IV divided to 50 ml per hour equals 20 hours. So the IV of 1000 ml will be infused for 20 hours. In pediatrics drug calculations, most drugs in children are dosed according to body weight in milligram per kilogram or body surface area or BSA mg per m2. Care must be taken to properly convert body weight from pounds to kilograms. For example, 1 kilograms is equivalent to 2.2 pounds. Before calculating dose based on body weight. In addition, administering medications to pediatric patients demands careful considerations of their age, weight, and specific physiological characteristics to ensure safe and effective treatment. Following these four steps can make your pediatric drug calculation easy peasy. Step 1. Convert pounds to kilogram. For example, the child weight is 22 pounds times 1 kilograms divided to 2.2 pounds equals to 10 kilograms. Step 2. Calculate the dose in milligram. The result of the calculations of kilogram is 10 kilograms weight of the child times 40 milligram per kilogram day recommended dose given by the doctor. So the answer is 400 milligram per day. Step 3. Divide the dose by the frequency. 400 milligram per day divided to two doses equals to 200 milligram per dose. Step 3. Convert the milligram dose to ml. So 200 milligram per dose divided to 400 milligram per 5 ml, the stock on hand of the suspension. The answer is 2.5 ml. So you will give the child 2.5 ml of the drug. Example, the doctor orders amoxil for a child that weighs 63 pounds. The safe dose range for this medication is 50 milligram per kilogram per day, every 8 hours. What is the safe dose for this child per dose? A. 211.8 milligram per dose. B. 47.9 milligram per dose. C. 1187.3 milligram per dose. D. 477.3 milligram per dose. The answer is D, 477.3 milligram per dose. The computations are 63 pounds times 1 kilogram divided to 2.2 pounds. The answer is 28.6 kilogram. The 28.6 kilogram, the weight of the child, times 50 milligram per kilogram per day, the recommended dose given by the doctor. The answer is 1,430 milligram per day. So in 24 hours divided to 8 hours, so there will be a 3 doses per day. So 1,430 milligram per day divided to 3 doses. So the answer is 477.3 milligram per dose. So another easy example, a child is prescribed erythromycin. The recommended dose is 40 milligram per kilogram per day in 4 doses daily. If the child's weight is 15 kilogram, calculate the size of a single dose. The formula is weight in kilogram times recommended dose in milligram per kilogram per day equals milligram per day. So the given is 15 kilogram the weight of the child times 40 milligram per kilogram per day, the recommended dose, equals 600 milligram per day. Then 600 milligram divided to 4 doses. So the answer is 150 milligram per dose to be given to the child. Next is pediatrics volume drug calculations. The formula is volume required equals strength required divided to stock strength times volume of stock solution. Example: a boy is prescribed pethidine 35 mg IM. The stock ampules contain 50 mg in 1 ml. What volume must be withdrawn for injection? So going back to the formula, the volume required equals strength required divided by stock strength times volume of stock. So 35 milligram divided to 50 milligram times 1 ml. So the answer is zero point 0.7 ml to be given to the child. Another example, a child is prescribed digoxin 40 micrograms IV. Pediatric ampules contain 50 micrograms per 2 ml. Calculate the amount to be drawn up in a syringe. So, the formula is volume required equals strength required divided by stock strength times volume of stock solution. So the 14 microgram divided to 50 microgram times 2 ml. So the answer is 1.6 ml to be drawn in the syringe. For adult drug calculations is very easy. To solve, we'll be using this formula. Amount required equals strength required or SR divided to stock strength or SS. A simple question. 750 milligram of ciprofloxacin is prescribed. On hand are 500 milligram tablets. How many tablets should be given? The strength required is 750 milligram and the stock strength is 500 milligram. So to get the tablets, 750 milligram divided to 500 milligram equals 1.5 tablets should be given to the adult patient. Adult and pediatric drug calculation exercises questions to practice. One, how much is drawn from a patient ordered an injection of 80 milligram pethidine? Each stack ampule contains 100 milligram per 1 ml. Second, a child requires 50 milligrams of phenobarbital. If stack ampules contains 200 milligrams in 2 ml, how much will you drawn up? Third, what volume is required for the injection if a patient is ordered 500 milligram of capreomycin sulfate, and each stack ampule contains 300 milligram per ml? 4. A patient needs 5,000 milligram of medication. The stock solution contains 1 gram per 1 ml. What volume is required? 5. If 1,000 milligram of chloramphenicol is given and the stock on hand contains 250 milligram per 10 ml in suspension, calculate the volume required. 6. A patient is prescribed 3 grams of sulfadiazine. The stock contains 600 milligram per 5 ml. How much stock should be given to the patient? So there are answers below for your reference, but you have to calculate each questions.